welcome back to the ballroom. And I trust that all of you have already switched your mobile devices to the silent mode. Thank you very much. And coming up next, we have a talk about the enhancement of migrant worker health and productivity through comprehensive COVID-19 vaccination programs. And to do us the honor of presenting this talk, please join me and put your hands together to welcome on stage Dr. Nicolas van der Velde, Executive Director of Health Economics and Outcomes Research at Moderna. A big round of applause for him, please.
Thank you, everyone. Can you hear me? Okay. So I'd like to thank SATA CommHealth for inviting me to give this talk. And I've been really impressed by the discussions this morning about all of those improvements already for healthcare workers, mental health, and all of those initiatives that you're already doing. So today I'll be going through a couple of additional topics. I'll again look at the migrant workers in Singapore, the burden of disease of COVID-19, which remains high, and then the importance of COVID-19 vaccination in this population. So I won't spend too much time on this one, because one of the speakers this morning already described the population in Singapore of the migrant workers. So almost 500,000 workers employed in the construction, marine shipyards, and process in Singapore from different origins. So this is the total. And then you have this 1.77 million of people, and in there, 24% of them are working in the CMP industries. In terms of age distribution, obviously, the working age groups, 25 to 30, this is the highest one, and then it goes down. From a socio-economic perspective, the revenues are lower. So those are all considerations when we look at the vulnerability for vaccination programs. So what was unexpected, and that's a study from 2022 from Mata et al. In Singapore, was the high prevalence of chronic conditions among migrant workers in Singapore dormitories. So that's this study which showed that 34.7% of dormitory dwelling migrant workers in Singapore have cardiovascular risk factors and other non-communicable diseases requiring ongoing care and follow-up appointments. So those are the different chronic conditions. Those are the different chronic conditions that were reported in this study. So data were collected from 883 migrant workers who had mild or asymptomatic SARS-CoV-2 infections admitted to 3 different isolation wards between April 6, 2020 and the 31st of May 2020. So a significant percentage of the cardiovascular risk factor and other NCDs were previously undiagnosed and attributed to a lack of robust screening processes. So that's what happened during the first wave, right? Is that you had, that's the daily confirmed COVID-19 cases in Singapore, and among those cases, then the vast majority were migrant workers. So if we look at the cumulative seroprevalence, that was estimated at 63.8% in migrant workers, whereas in the general population, we had only 0.16%, which, as of the 14th of December 2020, the study reported that 93% of the 58,320 who tested positive for COVID-19 via PCR test were migrant workers living in dormitories. And obviously, the obvious situation came from the crowded dormitory living conditions, the delayed provision of access to testing facilities and services, and then the financial insecurities hindering access to healthcare services. So since then, a lot of improvement happened, and so I'm just quoting a few here that have been mentioned this morning already, in addition with so many other improvements. So from September 2021, improved standards for new migrant worker dormitories were developed to strengthen the resilience against future pandemics and enhance the livability of those conditions. And then new standards included modular living, more spacious rooms, better ventilation in room and toilets, etc., were also put in place. Since April 2022, the Ministry of Manpower mandated the PCP, as it was discussed this morning already, so that was well discussed. So most of the primary care needs of migrant workers will be covered under the PCP, such as unlimited acute or chronic medical conditions and treatments. Here. So that's the going back to the COVID-19 cases in Singapore. So that's the total cumulative number of cases over the since the beginning of the pandemic, 3 million cases and 2,000 deaths. So you can see there all of the waves, not only the first one, but then the Delta, the Omicron, the BA.4/5, and all of the others on this graph showing the daily new cases. And a few of those peaks are still happening today, so that's an example reported on the Ministry of Health website, from the 5th of May 2024 to the 11th, like during that week compared to the previous week, we have seen as well a large increase. And then, so those peaks are still happening today, but they are not reported anymore on the public website. So that's a slide about the burden of disease. And it's important to see that the COVID-19 burden in Singapore remains significant in the general population, right? Particularly among patients with underlying medical conditions. So you see the red are the severe cases of COVID-19, and in blue, as a comparator, you see the positive cases for flu. So you see a factor 4 for the COVID, and it's even more than 4 because those are the severe cases versus the detected flu cases. So it's still a very high burden, and this is data from September 2023 to February 2024. Another important factor, as it was mentioned this morning as well, is, and in the introduction, because of the high prevalence of chronic condition in migrant workers, there is a lot of literature and articles reporting as well that hospitalized COVID-19 patients in Singapore with prior medical comorbidities had a 4 to 10 times higher chance of having pneumonia. And so we see also different chronic conditions there, as diabetes, that's the odds ratio for so the chance of having pneumonia, and then hyperlipidemia and hypertension. So all of those are multiplication factors in terms of risks compared to patients without those conditions. So comorbidities are very important when we look at COVID-19 patients as well. This is data from the US, again showing that the burden of disease is obviously like we are moving into a pandemic phase of the COVID-19, but still the burden remains very high. So that's a comparison with flu and RSV, and we see that although the peaks are getting smaller from the pandemic, then we still have a much higher incidence of COVID-19 compared to the other respiratory viruses that we see in the US. Data from Hong Kong here about the long COVID, right? So those are the symptoms, from 6 to 12 months post-infections. And we see that, in Hong Kong, you have 55% of the non-hospitalized COVID-19 patients who report at least one COVID-19 long COVID symptoms 6 to 12 months after the infection. So and you see that that's a, oops, sorry, again, I forgot to move those. And you see that it is across the age groups, right? So it's not like the older age groups in this case, where most of the long COVID burden is, but also in the active working population, which is important in terms of impact, as we are going to discuss later. Again, the comorbidities on the right side here, with the lung disease, liver injury, acute kidney are also important. And so in patient 18 years who had a SARS-CoV-2 infection between April 1st, 2020 and May 31st, 2022, they incurred a greater risk of following post-acute sequelae compared to the control cohort. And those are the hazard ratios as well, so the increased risk with comorbidities of having increased risk of post-acute sequelae. This is data from the US, also showing the impact of long COVID. So 18.4% of all adults were estimated to have experienced long COVID, and also the impact on productivity, because 25% of them 25% of them also report having significant activity limitations. That's a study from the New York State Insurance Fund, saying that 18% of workers with long COVID had not returned to work, 1 year after infections. So they looked at the compensation claims, and that's more of 3,000 established COVID-19 workers' compensation claims that they looked between January 1st, 2020 and March 21st, 2022. And so those 18% of claimants with long COVID, which makes up 5% of all COVID-19 claimants, had not returned to work more than 1 year after they contracted COVID. So in blue you have the return to work, and in red the return to work, and in blue the remaining out of work. This is data from Dutch employees in small and medium enterprises, a comparison of COVID versus flu work absences. So showed longer median time and lower probability of returning to work from COVID. So you see the median time to return to work was 10 days for COVID-19 compared to 6 days for flu-like symptoms. And that's based on a large sample size. So the first bar here, like less than 1 week and then less than 2 weeks, 6 weeks, 12 months, and 26 weeks. You have the first one being the COVID-19 overall, and then all of the variants, compared to the flu-like symptoms, which is the last one. So 34% of them returned to work, compared to 70% for flu, below 1 week, and so forth. So you see that COVID-19 has an impact on productivity, and it takes longer for employees to recover. I'm going across, some of the countries which reported such data. So this is the UK. And in the UK, again, you see that long COVID patients in the UK experienced marked worsening in work performance and reduction in monthly income. So in red is the pre-infection, and the measurement is how health problems affected work performance. So from 0, very little, to 100, profoundly. You have, again, the different columns there showing overall below 1 year, between 1 to 2 years, and above 2 years in terms of the long COVID duration. So overall, over half of the sample had reduced paid work hours and no longer engaged in paid work. Also, in terms of proportionally, the monthly income declined by 24% in the overall sample, and then as with the duration of long COVID, you have 18.5%, and then a decrease by 24.1%, and finally 41.5% for the group with over 2 years of absence. So endemic does not mean mild. Actually, COVID is here to stay, so we need to pay attention. And so I have two things here. The impact of the SARS-CoV-2 infection in terms of the burden is significantly higher than influenza. Patients with long COVID show greater clinical complexities and a larger burden of comorbidities. That's important in terms of what we've seen for migrant workers. And then there is an impact on the work productivity, which affect businesses and the economy. In terms of the vulnerable populations, those living in poverty and underserved groups may face higher risk due to reduced access to healthcare. Having chronic disease or compromised immune system can result in increased risk of severe COVID outcomes. And then, younger healthy adults may still be at risk of developing long COVID. So 2022, 3, and 4, the MOH recommendation for the COVID-19 booster vaccination. So this is still recommended for the entire population. The vaccine is for free for individuals who receive an additional dose approximately 1 year after their last booster dose. They can start receiving it 5 months after the last booster dose. And they encourage the vaccination in all individuals aged 6 months and older, especially healthcare workers and household members or caregivers of medically vulnerable individuals. And medically ineligible, if people are ineligible for mRNA vaccines, they can have the Novavax vaccines. The booster is recommended for persons at greater risk of severe disease, including those over 60 years, those who live in long care facilities, and those who are medically vulnerable. Here, COVID-19 vaccines can now be given with all other vaccines across all ages. So the importance of the program in Singapore during the pandemic. So estimates from the Ministry of Health showed that vaccination averted about 8,000 deaths, 33,000 severe cases of COVID-19, and 112,000 hospitalization cases between the 1st August and the 31st of December 2021, when the Delta variant infection peaked. So those are the reduced cases from no vaccination to vaccination in red. Okay. So this is a study in Singapore, and you have the reference there from 2022, and they showed that the first booster, so the third doses in Singapore, so that's the mRNA booster vaccine, provide markedly increased protection against COVID-19. And so that's the study design to determine the level of protection. The study included Singapore residents above 30 years of age with at least 2 doses, and they were looking at the third doses. And that's a mix of different doses, mRNA doses, and whole cell virus as well. And so those are the results showing that against severe COVID-19, an estimated mRNA booster effectiveness was 87.4%, 15 to 60 days after boosting, and 87.2%, 5 to 6 months after boosting. We saw no significant difference comparing vaccine combination. Booster effectiveness against severe COVID-19, 15 days to 330 days after the third dose. So it was a bit lower for the whole cell virus, and so 2 doses. So a 4 dose may be needed, and that's where we are at the moment. Just on the COVID-19 vaccine safety surveillance in Singapore, we had almost 16 million doses of monovalent administered, and 1,300,000 doses of bivalent mRNA COVID-19 vaccines administered, and the serious adverse events reporting rates are the following. So for the primary series, 0.009%, and then it decreases with the number of boosters. So the incidence of myocarditis remains rare, with reporting rates of 0.2 per 100,000 doses for the bivalent vaccines, which is lower than the 1.1 per 100,000 doses for the primary vaccination with monovalent vaccines. So this is a study from the US looking at a different database. So this is the Verde network EHR linked to claims data in the US. And this is looking at the updated XBB vaccine. So the season is 2023 to 2024. And again, the design is a retrospective cohort study using those claims, close claims only. And the analysis is, so we match, vaccinated and unvaccinated. Unvaccinated meaning, all of the background in the population. So 1, 2, 3 different number of doses in the population. And so this study is showing that, the latest booster had a vaccine effectiveness of 60% against, for the different age groups, related, against hospitalization, and around 35% against, any medically attended COVID-19 infections. This is the vaccine effectiveness that has been published regarding long COVID. So the vaccine is also very effective against long COVID. And those are the results for 1 dose, 2 doses, and 3 doses. So the vaccine effectiveness is 21%, 59%, and 73% for people who got the 3 doses against long COVID. So now I'm going to talk a little bit about health economics. And so this is a study, again, based in the US. And so we look at an average company in the US with 10,000 employees. And then we look at, again, based on those results in terms of vaccine effectiveness, what has been prevented, and then the absenteeism of those employees in those companies and what's the impact. So we look at the 2023-2024 vaccination season and look at both employers and employees compared to the scenario of no vaccination in those companies. So that's the methodology and limitations. And so you see that without workplace vaccination, an average US business had an estimated 18,000 absent days from COVID-19, resulting in a productivity cost of $5 million US. And implementing COVID-19 workplace vaccination at 70% US healthy people target vaccination rates prevented an estimated 3,132 absent days, saving employers almost 900,000 in lost productivity costs, as well as almost 250,000 in terms of medical costs. And it also saved employees 182,000 in medical costs and almost 200,000 in lost wages. So that's a look at the health economics of vaccination for employers. So improving the health security of migrant workers is essential for the economy. In terms of GDP for Singapore, the manufacturing, construction, and transportation and storage is representing 1/3 of the GDP, and disruption owing to pandemic, could be very damaging in terms of the economy as well as for all of the workers. So the key elements for a successful implementation of a vaccine program. So those are the key elements for the implementation of vaccine program. So first, they need accessible vaccination center and mobile clinics. So the establishment of strategy, having very, close centers where migrant workers can live and work, and mobile clinics to overcome the barriers to accessibility of the vaccine. Then the collaboration with employers to make sure that the coverage rates can be as high as possible to raise vaccination awareness with the workers and making sure that we can maintain this high level of coverage. Obviously, as was mentioned this morning multiple times, the language barrier can be an issue, so making sure that we have multilingual support for understanding the need for vaccination and how vaccination can help them perform and stay healthy. And then making sure there is a monitoring system and that we can follow up those employees, and making sure that we maintain a very high coverage in those populations. So in summary, migrant workers are obviously at higher risk for the different reasons that we mentioned. And also because of the chronic conditions that have been reported. So it's very important to maintain a high coverage in this population in terms of being healthy and productive, and also that may impact the community and employers as well. So implementing accessible vaccination programs, including seasonal campaigns, is crucial to mitigate severe outcomes of COVID-19 and maintain a productive and healthy workforce. So continuous efforts, including proactive vaccination, education in healthcare, access improvements are necessary to safeguard and improve the health of migrant workers in Singapore. Thank you very much.
Now, ladies and gentlemen, once again, the floor is now open. If you have any questions, you can kindly proceed where the mic stand is and let us know what questions you have to ask, or you can also introduce yourself. Anybody, any questions? Sure? Everyone's so clear about everything? Yes? Okay, if that's the case, I'd like to invite SATA CommHealth CEO Dr. Calvin Puat to please come on stage to present a token of appreciation to Dr. Nicolas von der Velde. Yes, and let's have a photo opportunity to capture this moment as well. Thank you very much, gentlemen. May I invite you to take your seats? Thank you.